Good afternoon, everyone. We're here to talk about the results from Alan's 2023 Mental Health at Work research. And this survey was conducted in Spain. And we're going to discuss not only the findings of this comprehensive research on mental health at work, but we're also going to hear from SeekerSource. SeekerSource is an IT development company with a strong focus on employee well-being, and they will share how they have helped improve the mental health of their remote workers. And as you might have just seen, we're going to be recording these sessions, so you're welcome to turn off your cameras and sound. In any case, you will all have a voice if you have questions. So we're going to be putting in the chat in a minute a link to a Slido. So if you have any questions during the webinar, please add them on to Slido. If you go to slido.com and enter the code on your screen, it will take you directly to our setup for this afternoon. We're aware that some people don't feel safe putting their names next to the questions, so on a Slido you can submit questions anonymously, which is quite nice. And once you have entered the code and you're in Slido, you can also see other people's questions, and you decide to upvote any questions that you really would like answered. As I said, the chat will have the direct link, or just slido.com and then enter this code. So let me make the introductions first. So today our speakers are Irene Martinez and Richard Clark. Irene is the General Manager at Alan Health, and Alan Health is the first digital health partner company in Europe. Irene has an extensive professional career in the insurance sector, and she's working at Alan to take the insurance to the next level. With a degree in mathematics and a master's in statistics, I think it's fair to say that Irene knows her numbers and she uses them wisely to build the best features. So thank you for being here this afternoon, Irene.
Hello, thank you for being here. Thank you, Naida, for the introduction.
No problems. We're very happy to have you. And we also have Richard. Richard is one of the founding partners of SeekerSource. And as I mentioned before, SeekerSource is a nearshore web development agency. We're based here in the Canary Islands. And we have a team of nearly 40 developers providing services to clients based mostly in the UK and other European, North European countries. Richard has a wealth of experience managing remote teams and is super passionate about employee happiness and well-being. I can testify to that. So today, yes, we will talk about this research that Alan conducted, and in particular to the well-being of remote workers. And we're going to chat to Richard about some of the techniques that you can use to help improve the well-being of your employees, particularly your remote employees. So I would really love to start with Irene and ask you, Irene, about a quote that I read from you saying that working on this research and compiling the findings was one of the most eye-opening experiences that you have had. So I wonder, why was that? And if you could talk us through the main findings of the research, please.
Yes, I think we have the numbers there as well. So yeah, it's showing. So this is why I think it's very wide opening. First of all, the mental health barometer was done with more than 2,000 employees all over Spain from different segments, different industries, different age, gender, etc. So it's a very wide representative sample. And we did this because we wanted to understand how employees are feeling and what are companies actually focusing on right now, what are the challenges, what they can do. No? And why is it wide open? Well, you can see the numbers now. We see that 2 out of 3 employees are going through stressful situations. So they're suffering from stress. So it's quite a lot. And more than 50% are either, 50% are with fatigue and work fatigue, and they're experiencing these problems. No, and then we see that 2 out of 3 as well have problems to disconnect from work. So as a result, as a consequence, more than half of the population are saying that they're not taking care of themselves. So it's not just the mental health that is affected, but also the physical health. So when we see these numbers, we're really putting names and data and information to understand the problem of mental health. And we know that mental health is more and more something that we're talking about. But seeing these numbers is really, there's a lot to do still. And I think it's something to take into account and to really focus on.
Wow, that is super interesting. And we would like to ask you about more findings relating directly to how it affects the workplace, please.
Yes. So obviously, if people are suffering from mental health, it affects their daily life in their day to day, and their day to day has their work, and it affects their mood. It affects how they interact with their colleagues, how they are tackling their job, and how they're motivated to perform their job. So obviously, it's going to affect their performance. But what we see is that 35% of the population is saying that they're willing to resign from their job. And if we look at younger population, like younger than less than 35-year-olds, the number increases to 50%. So if you think about it, it's like 1 out of every 2 youngsters, they want to leave and quit their job. So that's a quite an impressive number. It's really, really threatening, really, really challenging. And so obviously it's going to have an effect on turnover for the companies, but not just turnover. We've seen also in the study, we asked, how do you feel about sharing or about discussing how you feel about mental health at work with HR, with your supervisors, and more than half of the people said they didn't feel comfortable to talk about these topics. So that in the end they're ending up with sick leaves from mental health, and we know that the statistics is that sick leaves from mental health are around 100 days. So that's many days. So it has an impact also on sick leaves. So if we take performance, turnover, sick leave, so it's going to impact the work, it's going to impact companies, not just as an emotional cost, but also as a big financial cost. So really, it does have an impact at the workplace.
As a HR professional, now you're stressing me out with those numbers. So we were wondering if the results for remote workers were at all different, and what did the research show, especially about mental health with remote workers?
Right. Yes. So we know that remote is something that is really valued, and that more and more people want to work remote. And in fact, people who work remotely, they score themselves as being happier than people who work in the offices. But when we dig deep about their challenges, about how they feel stressed, about their motivation, they're just not worse. They're always worse than the office workers. And this can be for the fact that it's easier to disconnect when you're remote than when you are not remote. It's also they are distance from their colleagues because you don't have the day-to-day social interaction that you have when you go to the office. But a positive thing is that we also ask in the survey, do you know what resources you have in your company? Do you have any resources? Are you aware of those? And usually remote workers are more aware of the resources available for them at work. So that means that they have a way to find a better solution. But indeed, they are worse hit by mental health.
I see. Richard, you said that Sticker Stores have been working remotely since well before the pandemic. So I wonder what are your thoughts when hearing about all of this?
No, it doesn't surprise me at all, right? I think all the studies they've been coming out this year, and they've been showing that the remote work, if you don't look after your remote workers, then they will experience worse mental health than your in-office workers. And I think that's probably one of the reasons that a lot of companies are now asking their employees to come back to the office. Right.
So what can we do?
What can we do? Okay, there's lots of things you can do. Okay, lots of things you can do. I'm gonna just tell you a quick story. So probably about 3 years ago, just before 3.5 years ago, just before COVID came in, we had a new team, 3 developers, and they were working for a client in the UK, and it was fine for the first couple of months, and then after about 2 months, we noticed that our team and the client's team were not so happy. We measure happiness every week, and so we know how happy our teams are. And we noticed they weren't happy. So what we did was we looked into it. We wanted to find out what's going on. So we attended a couple of their meetings, And we saw the problem almost immediately. And what we saw was that they weren't actually talking to each other, our team and the client's team. So yeah, they were talking, they were very polite, they were very professional, but they weren't asking questions, they weren't challenging each other, okay? They just didn't feel safe in each other's company. So we've experienced this before, we've done a lot of research in this, so we knew what to do. So the first thing we did was we looked at how our clients ran their meetings. And the first one we did, the most important one, is probably their sprint retrospective. This is a meeting that you have every 2 weeks where the whole team get together and they discuss how they think the last 2 weeks have gone. And the way our client used to run it, because they used to have an in-house team in the UK, and the way they used to run it was that everyone would just come to the meeting, and one person would go, right, how do you think it's gone for the last 2 weeks? And then point to someone and they'd answer. And they weren't contributing. So we suggested changing the format a bit, make it more structured. So the first thing we did was we allowed the team to write down their answers. Okay, so instead of being put on the spot and to have to say their answer there and then, we gave them the questions at the start of the meeting. Sometimes we gave them like an hour before and gave them time to think about it and write down their answers. And we found that helped a lot. And then we looked at how the questions were being asked. So a question like, how do you think it's going, to a young new employee, they're going, oh my God, what does he mean? Does he think, I don't know if it's going well, I don't know if it's going badly, what should I answer? It's a slight panic. So we taught them how to ask questions that people will find easier to answer. So instead of asking that question, which is a bit open-ended, a bit ambiguous, you could say, name 2 things that have gone well in the last 2 weeks. Name 2 things that could be improved in the last 2 weeks. And what we found was that over a month, 2 months, our team felt safer asking questions. They were giving answers. They realized that nothing negative was going to happen, and they opened up. And after about 2-3 months, our team were talking with their team as if they'd been friends for life. So going back to your question, sorry, I was just rambling on a bit there. So there's a lot of things you can do to help improve the mental health of your remote employees. But for me, the most important is this thing called psychological safety.
Yes, I jumped the gun there. I knew you were going to talk about it.
Yes, right. So if you don't know what psychological safety is, one, you haven't been to any meetings with me because it's all I ever talk about. But psychological safety is if you're in a group of people and then you feel safe to ask questions, to challenge other people without any fear of them saying anything negative back to you, right? And psychological safety is super important. Google did a massive study on what were the characteristics of their highest performing teams, and psychological safety was the most important factor. So not only is it important for your mental health, for your well-being, but it's also important for the performance of your team as well. And when you feel safe in a team, you actually feel happier, right? You collaborate more, so you socialize more, and you feel more part of a team, okay? So even though there are hundreds of things you can do to improve the mental health of your team, just focusing on this one thing, psychological safety, will be a massive step, okay? So how do you build psychological safety? Ready, Naira? Next slide. How do you build psychological safety? Right. First thing I want to point out is it sometimes happens naturally in teams. Sometimes a team get together and they feel safe together, especially if they're similar people. But sometimes it doesn't happen, especially in remote teams. So you need to actually be proactive and more intentional about how you do it. So the first thing you need to do is you need to educate people. What is psychological safety, right? What it is, why it's so important. And the most important thing for me is you need to teach people that the psychological safety of others is actually their responsibility. So take a classroom, for example. For a student to feel safe putting their hand up and asking a question, that's not the student's responsibility to feel safe. It's the teacher's responsibility to create the environment for the student to feel safe. And it's the same in a company. It's your responsibility to make the rest of your team feel safe. Next thing, build personal relationships, right? You know, it's a lot easier to ask your friend a question than it is a stranger on the street, right? So build personal relationships. Now, this happens more naturally in the office. When you're remote, you have to be more intentional again. So create times when people can talk about non-work stuff, whether it's before meetings, after meetings, whether it's random times during the week. You have to be intentional. You have to give your team space to build those relationships. And that's talking about Netflix, football, ballet, whatever, tap dancing, Naira. Yeah. Okay. And the final thing you have to do is to monitor it, right? Teams change. And if you notice that someone in your team isn't contributing as much, that's probably because they've lost their feeling of psychological safety, maybe because someone new has joined the team. Okay, and that's how you do it. All right, this slide. Okay, so here's some specific little techniques you can do. Provide different ways for people to contribute. Some people don't feel safe speaking, let them write it down. Breakout rooms. You feel a lot safer in a small group, use breakout rooms, okay? You're more likely to contribute in a group of 3 or 4 than you are in a group of 20. Frame questions, that's what I talked about before. Make questions easier to answer, less ambiguous. And final on polls. If you've got a question that the people are afraid of answering honestly, okay, because they don't know what the reaction will be, do it anonymously. Polls are a really good way of doing this. Okay, they feel safer answering anonymously than putting their name to something. That's why, okay, least useful goes back to Slido. Why we use Slido. One, we've allowed people to write their answers instead of having to put their face forward and say something. And also we've allowed people to ask anonymously, because that way they're more likely to ask a question. There we go.
Thanks.
Thank you. Sorry.
So Irene, we mentioned at the beginning of the chat that 2 out of 3 employees reported difficulty disconnecting from work, which, you know, it's outstanding. And I was thinking that surely working from home, as we do at Secret Source, because we do work from home quite a lot, that cannot help with that, right?
Correct. So when we looked at the study, we also looked at the difference between office workers and remote workers, and we saw that remote workers have more difficulty in disconnecting. So 31% say they cannot disconnect, whereas they can disconnect. Sorry, whereas it is 41% in the office worker. So it's they're healthier, no, the office workers, and it's normal. No, we were saying the disconnecting from if you're working at home, it's more difficult to define the boundaries between your personal life, your work life. When you're at the office, you finish, you then have to go to work, so this to your home, so it's like a break, and you are, you know, you have also like a transition between you go from your office to the work, so you can walk, you can take the car, but you disconnect. You are doing something different, and you have like a gap, and you're not changing totally atmosphere. So this thing is something that is important, no? That to allow to have remote workers able to have a space to disconnect, and encourage the teams to speak openly to each other, and to encourage this connection, no? And give them the tools that it's okay how they should do it. Also, the fact that they are distant from their colleagues. For example, at Alan, we also work a lot remotely, and what we do is we favor a lot all the discussions are done async in writing. No, so we don't take decisions if it's not in writing, and that encourages that everybody feels part of the decision, because if you don't have to be in the meeting, you don't have to be in the office to take the decision. We're taking every decision in writing in a discussion that is open to that is open, shared transparently. So those are things that can encourage that, and also to have, you know, some some places where you can have also relax, no? And you can say, okay, we have this chat in this channel in Slack where we can put jokes, or we can praise the team, because also remote workers are far away from the rest, and they can feel sometimes that they're not recognized, that their work doesn't have the same visibility as the others. So these are things that could help, no? And definitely there is something that we need to work on, like Richard was saying, no?
So Richard, yeah, anything else that your team of remote workers do to respect those boundaries between work and home?
Okay, there's a couple of good ones here. So I used to really struggle. Well, I used to work from home from about 2008 to 2015 by myself. And I struggled disconnecting. And what I found really worked for me was at the end of the day, I'd turn off my computer, and every day I'd go for a walk. Well, I'd walk my dogs with my wife. And just that simple action broke the day in two. There's even, I know a friend of ours, he works from home, he works in insurance. And every morning he gets up, gets his suit on, walks around his house, comes in through the front door, goes into his office, spends the day on the phone or on Zoom or whatever. At the end of the day, turns off his computer, leaves his house, leaves his office in his suit, walks around the house, comes back in, goes to his bedroom, gets changed, right? And that's his ritual, and that breaks his day up. But it is really important. I think what's the key thing is you need to tell your employees that it's okay. It's actually better. It's good to not be working outside hours. You need to tell them, and it's acceptable that to not answer emails outside work. It's not just acceptable. It's not expected, and it's bad to answer. If you can give that to your employees, it will really help them. Now, there's a couple of companies like Asda, for example. It's a big supermarket chain in the UK. Emails don't work from 7 p.m. to 6 a.m. in the morning, which is super useful. Daimler is another good one. They have a system. If you go on holiday, all your emails deleted. Anyone who sends you an email, it gets deleted, and when you come back, you've got nothing in your inbox, which is quite nice. But yeah, set boundaries. I think set boundaries, and if you're an employer, yeah, make it clear that it's okay to not work outside work hours. Yeah.
Amazing. So Irene, getting into the particulars of what Alan can do for the well-being of employees and the mental health, could you talk us a little bit through your offerings?
Yes, very happy to. So we want to be for our clients, we want to be their health partner. And as part of their health partner, we take care of their physical health, but also the mental health. And what we do is we have a network of our own psychologists that we cherish very much, and that we take our time to recruit them, to have the best professionals that we can find with the significant experience. And one thing that we do is that we give online therapy with this network. And this online therapy doesn't need to have a prescription, which is sometimes that there is some friction sometimes with other health insurance, that you have to have your prescription from your psychiatrist to then go to the psychologist. In this case, we don't have that, so that people can go freely and they don't have to have barriers or to access the therapy. And it's working really well. One thing that we're very proud of is that 75% of we carried out a survey also with our members, 500 members, more than 500 members, and 75% of them said that they had done therapy for the first time thanks to Alan. So that's quite impressive. No, we're very proud that we're bringing it and making it accessible to many people. No, many people that before hadn't thought about using therapy, and now they're accessing to therapy. And also, it's working well because we see that 50% of the people come because they got recommendations from others. So word of mouth is working. They're having such a good experience, and they're having a solution to their problems, that they're doing this. And it's not just a psychologist, because you have a problem, you go to a psychologist, but we want to give more prevention, give more tools. And in our app, you can also access meditation exercises, breathing exercises, so that can support you in your day-to-day and not just the therapy. And finally, another thing that we're doing with customers is to work from the company, not just the employees, but try to find solutions to the company, analyze their psychological risk, and with that, we can work with the HR teams to provide some workshops and see with the leaders to try to motivate or understand how they can get things better. So there can be a workshop, for example, on how to identify burnout, how to manage stress, how to get engagement with hybrid workers. So there are various things that we can do, and that way you work with the whole company, and it's not just one by one on the employee, but you have a holistic solution.
Yes, and I was jumping the gun again there because I just feel very strongly about it coming from HR. And there is this quote from the World Health Organization that talks about what is the return that you get when you invest in a health partner. And I feel that it just makes business sense. It's exactly what you were saying. And for us in Secret Source, when it came to choosing a health partner, it made 100% sense to go with Alan because you guys offer a fantastic digital platform, and our team, they are an IT team, they are developers, and a traditional insurance, we just wouldn't work. We used to have a traditional insurer where you have to be on the phone and sending emails, and it's getting authorizations continuously for everything, and it just didn't work. We only had one person using it out of the 40 people in the team. So that showed us that we needed to find other type of partners. And with Alan, and all these digital features that you guys have, you have your digital card, and you can manage your account online and add your dependents, and you can search specialists using an interactive map where you put your postcode and you see where are the doctors near you. You can even book medical appointments online, and one of my favorite features, you get a doctor 24/7 online that you can talk to, and it's not just a general practitioner. There's a lot of different specialties that are available to you, and you can also check what's covered and what is not covered exactly. And if you do require authorizations, you can get those very easily from the app. And at least here in the Canary Islands, it's a small island, and you need to make sure that you have a good network of specialists. And we found that Island covered, all the main hospitals, private hospitals, and the best clinics and specialists. And since we introduced it, we're super happy. Since we introduced it a year ago, look at the usage. As I said, we have 40 employees, 29 of them, nearly 40, 29 of them have subscribed to Alan, when before we only had one person. And this is our utilization data that I requested from your team. And, it's quite remarkable. This is the data for the claims this year. So 18 claims for employees, and they have had 112 medical claims. And then we have the addition or the breakdown of the psychologists, the mental health bits. So out of our 29 subscribers, 9 have requested therapy with one of the Alan psychologists, and they have had, each of those 9 have had 9 sessions. So for us, it's tremendously tremendously useful. We know how hard it would have been for them to access this type of help if it wasn't supported by the company. And it goes beyond the psychologists. I did ask for the rest of the data, and I hope you guys can see it. But apart from the psychology, they have access more traditional medicine like physiotherapy and traumatology and just general medicine, gynecology. So quite a lot of utilization. And I have 2 cases that for me as a HR professional were like amazing. And we have one person that was signed off by their GP with a mental health issue, and using Alan, they were back in a matter of weeks, when we know for certain that if they hadn't used Alan, they would have been off for months trying to access via the Spanish NHS, so the Social Security system, the public health system, trying to find help. It would have been months of being signed off, and now they're happily back at work, and you know, both the employee and us were like tremendously happy. But also more rudimentary cases, like in HR, I saw this employee who told me they had a urinary tract infection, that they suffer from them regularly, and it happened on like Sunday night to Monday. And they had a 9 a.m. meeting, and they say, if it wasn't because I remember that I had access to Alan and I could just ask on my phone a doctor online for the prescription that I know I needed, I only needed antibiotics, I would have had to miss my super important 9 a.m. meeting, because I would have had to go to the emergency room to get the prescription. So with Alan, I chatted to the doctor. They sent me online immediately the prescription. I went to the pharmacy, got it, and I was in the office perfectly on time at 9 a.m. already being treated, you know. So I was like, wow, that's just, you know, amazing. And the other one happened to me. I suffered from bronchitis during the last carnival, which is only relevant in the Canary Islands, but you would know what I mean when I said that it was carnival, is that the emergency departments were absolutely inundated, and it was Saturday night, and we were having an episode of Kalima, which is this very dusty airs, and I just couldn't breathe, you know, and I needed an inhaler, and I just thought, you know, if I go to the emergency room now, Carnival Saturday, I'm going to be there for like 7 hours, surrounded by drunk people, and it's going to be an absolute nightmare. And then I remember that we had access to the online doctor, and I spoke to the doctor, who reassured me because of my symptoms, I didn't need to go to the emergency room, sent me the prescription, went to the pharmacy, got my inhaler. I was absolutely perfectly fine, and rested on Sunday, and I was back to work on Monday without having to take a day off. So for me, not having to go to the emergency room during Carnival on Saturday is a miracle in itself, you know, and I'm super happy with it. So yeah.
It's really good to hear that all those examples, really, that's what make us super happy, that our members are really happy, they're satisfied, that we make a difference, that you can see the numbers, that we, as we say, transparency is one of our key values, and that we do it internally, we do it with our clients, and that's why we want to share the information, so that you can see actually the impact that is having, and which was really, really satisfactory for us to see this.
Yeah, so no, thank you guys. So everyone, I hope you found today's conversation useful. We're going to have now time for questions. And I want to, again, thank Irene and thank Richard for sharing with us today. Thank all the attendees. And I know I speak for the entire team at Alan and a Secret Source when I say that we truly enjoy looking after employee well-being, and no effort is enough for us to share best practices. And if we can help other companies or professionals, if you find any of this useful, we're here to help. And we're all available on LinkedIn, so you can message us if you have any further questions throughout the next days or weeks. But yeah, let's go to Slido and have a look to see if there have been any questions coming in. And I have Charlotte from our team, who I believe has been monitoring Slido. Charlotte, any questions?
Hi, everybody. Yes, Slido has been on fire. We have so many questions.
Okay.
Let's start with the most popular one. So this is for Richard.
Okay.
It says, do you believe that a hybrid working approach is the most effective?
Oh, this is really contentious. Okay, I personally do. Okay, because from my experience, because I like socializing with people at least once or twice a week. Okay, that's my person, and I personally believe that social interaction is absolutely necessary for good mental health. However, I also understand that everybody's different, and so hybrid might not be perfect for everybody. So in that sense, no. I think different things suit different people. And I think you have to be flexible, and you have to, for your remote workers, you have to make sure that they have the support they need. And for the people who are in the office, you have to make sure they have the support they need. But everybody's different, and you just have to treat them, you have to look after them all, but differently. So sorry, I didn't really answer your question.
Any other questions?
Yes. Next question down the line is for Irene. They're asking, how do you think the culture within a company affects the mental health of its employees who work remotely?
I think culture has a very, very big part in this, totally. As I was saying, at Allen, we value a lot our values, our culture, and having transparency, having a mission, and sharing with your employees some, like, something that you work for, that you all value together, having an importance of taking after your team. We take care of everyone. No? We being there for the team, being a team player is very important. And if you have a company where everybody is supportive and everybody is taking care of each other, that helps a lot. Also, we believe that people should have flexibility and autonomous. So we don't believe in hierarchy. We believe that you should be flexible, and this works with remote. No, you own your own time, and you should allow employees to have their autonomous and build their projects, and to have work and be part of something, no, and be able to work on that. And so yes, I think the culture is super important, because you, as Richard was saying, he was talking about psychological safety. If you have this culture where everybody can take decisions as well, at Alan, we value a lot that we take part. We have fearless ambition. We want to take part of the company's decision. Everybody has a say in everything, and everybody can challenge. So the feeling that you can challenge and you're expected to challenge is something that makes people be part of a project, be part of a company, and feel safe in that atmosphere, and totally helps. Super important.
More questions?
Next question is for Richard. So, considering that you were already operating remotely before the pandemic, did the pandemic induce any significant operational changes?
Yes. Okay. So just to make it clear, we were remote for our clients. So our clients were in the UK, we were here, but our team used to come into the office 4 days a week. So we were mainly office-based before the pandemic. Then pandemic happened, everyone went home, and then they basically never came back. So our team now come into the office maybe once every week, once every 2 weeks. So yeah. And so we had to take, as I was saying, we had to take lots of positive, intentional steps to make sure that our employees were okay remote. So we used to do things called random coffees. So every week, our team used to get together randomly and just chat about stuff not related to work. But now we just encourage our team to talk about non-work stuff. So in a meeting, we usually, the first 10 minutes is just talking about the latest thing on Netflix, or Naira's new tap dancing shoes, or something like that. And we show our staff that it's okay to do that. And in fact, we want them to do that. So we've been very intentional about it. And I think you have to be for your remote workers. Okay. Otherwise, they just, as Irene said before, they just don't feel part of a team. They just feel a bit lonely.
And if I might add, that used to annoy me when I was working in an office before I ever work from home. When I was going to a meeting and people chit-chatted for the first few minutes, it used to annoy me. I wanted to get straight into the fact. But now if we didn't do it, I would really miss it. And it was because before I used to have lunch or coffee or something with the people in the office. But now it's the only time I get to see some people. So I'm really looking forward to those, 5-10 minutes of chit-chat.
Yeah, perfect.
Sure.
Exactly right. Yeah.
So Charlotte?
Okay, next question is for Irene. In terms of your research, what kind of responses did it prompt? And were people surprised by it? And if so, what aspects surprised them the most?
Oh, I would not have to answer that one. I don't really know. I think when you're saying people, that they're referring to the people who we ask the questions to, or people in general. I think the questions were widely answered, and really, I don't think it took anyone by surprise. We knew it was a mental health questionnaire. I think what people sometimes that we found out is that they weren't really aware of what the company was offering. So there was that was something that they didn't know about, and sometimes they had things and they didn't know about it. But in general, I think it was a questionnaire on mental health, and all the topics were shared there, and I don't think it really took them by surprise. No?
Okay, we do have a couple of yeah, we have time for a couple more questions. Yeah.
And we have more questions down the line. So
Okay.
for this other question, it's for Richard. So they're asking, how can supervisors and colleagues best support employees who are facing mental health challenges at work?
Wow, okay, that's a big question. I don't think it's the responsibility of the supervisors or employees to treat or even offer advice for mental health because they're not qualified. I think it's pointing them in the right direction, make them feel safe that they can tell, they can speak up about it. So definitely make sure that your team feels safe saying that they're struggling. But once it gets to that point them in direction of Alan Health or Alan Mind and looking for the support they need. I think, yeah, we're not psychologists, so it's we've got to be careful. Okay.
There's another question for you, Richard, which is, how do you envision the workplace evolving over the next 10 years?
Wow, okay, that's a big question.
Such a guru you are now.
Yeah. So what I've noticed over the last so in the early 2000s, sort of mid 2000s, companies thought that the way to make their workplaces happy was to put a big yellow slide in between each floor, put sofas, put a big ball pit, have massive barbecues. They thought that was the secret to making their employees happy and getting people to come to work for them. I think what's happened over the last sort of 5 years, and especially since the pandemic, is all the research is coming out, so people know how to actually look after their employees, how to actually make them happy. It's not about big shiny objects. It's about giving them purpose in their work. It's about giving them career opportunities, respecting their home life, their boundaries and stuff like that. And I think I hope over the next 5-10 years, that will become normal, and employers will understand what employees actually need. And I'm hoping that the workplace will just become a nicer place. Okay, so think about 100 years ago, they thought the way to run a business was just to shout at people and beat them. We've moved on from that, and I think the next stage is where they actually realize what you have to do to make someone happy at work. That's what I hope.
And I would add that I think having a mission clear in your company, what's your mission, and be part of that mission is something that more and more the employees want, and having a culture that is aligned with that. So it's not just about working remotely, working physically, but really having a purpose and sharing it with your teammates and the company, and building everyone together, that special thing.
Definitely.
Yes. Are we done with the questions, Charlotte, or are there any more?
Oh, we have much more. People that were very active.
Okay.
Okay, next question.
1 or 2 more.
Okay. So the next one is for Irene. They're asking about, are there plans in place to repeat your survey yearly?
Oh.
Yes.
Okay.
I don't know if we'll do the same survey. Probably not, because we like to adapt it and to do changes. For reference, we're a French company, and we in France, we've been there. We're in Spain since end of 2020, but in France we've been since 2016, and they've carried several mental health parameters. So it's the first one for us in Spain, but they've done various. And what we try to do is keep changing the questions, finding out more things, focusing on more things. So we do have plans to keep doing these things. We don't know if we'll do a similar format, maybe change it slightly. We're thinking now about what we're going to do for next year. Maybe do shorter ones, but periodic in the year. But yes, we want to keep updated. In the end, we call ourselves a health partner for something, and not just for providing the service, but also giving these insights and giving us information to be able to improve, to be able to see how we can help companies support their employees and improve the well-being of the employees. So definitely we will keep doing them. And we're very data-driven at Allen, so we want to have
I wonder
data.
why. Says the mathematician, statistics. Okay. No, we love to hear it. Like we were really we related a lot to the survey and the findings this year when we read it at Secret Source. So it's great to know that you're gonna dig a little bit deeper next year. So thank you. Okay, Sharon, I think this is gonna be the last one because we like to let everybody off a little bit early.
Okay, well, this is a question that involves you, Naira, and also Irene.
Okay.
They're asking, besides offering a platform for speaking with psychologists, what other uses does the app have for employees?
The app is just like a health. We're a health insurer, but with all the technology. So as Naira was saying, everything that you can do with a traditional health insurance, you can do with Allen. But on top of that, we want to add health services like the online psychologist, like having the online support from a GP to chat to a specialist and have a quick question. But also you can book your appointment online, so you don't have to be on the phone and call the doctor. So you can do everything. All the experience is done from the app. So there's no other way to contact Alan to have access to the service. So when you have a question, you have in the app, you have the chat, and our care team answers quickly and swiftly to your information. If you want to, as Naira said, for example, you might take a surgery and you need to have an authorization. It's done through the app. You do the photo, you do the picture, you upload it, and the care team will take care of it and will transfer it, and you get an answer within a day or less. And so everything is done in the app. It's just all the full health services, and you have all the information there as well. So you have your coverage, what it covers, what doesn't cover. So all the information and all the support, it's done from there. And you have your virtual card. You can then add your beneficiaries, your dependents, so just any standard health coverage. Obviously, if you have to go to the doctor, then you have to go physically. But that's the idea. And our idea is to keep improving. Just to give you an idea of what we call health services. In France, we already are a bit more advanced, and we already offer, for example, not just psychology online sessions, but also support on back pain, for example, on how to address it and content, etc. So hopefully we'll bring more of that content here and have enriched the app, because we want to be really a health partner and not just a health insurance, but be there for our members so that they can take a preventive approach and not just reactive when they're sick. But if we can help them before and we can give them services before, that's our aim, no? And be there for them the whole time.
As a user, I haven't actually requested an appointment with a psychologist, but in the mental health section, there were all these videos about how to manage stress and guided meditation and breathing exercises. And there was like, I did flick through some of them, and there's some self-reflection tools, how you feeling today, and then why is that, and how can you replicate it tomorrow. And there's a few of the features where you can concentrate on your mental health and get some advice and tips without actually having to talk to a psychologist if you don't want to. So I saw all of those features as well, and I know, because a couple of our employees have mentioned it to me, I know that they're using that too. So yeah, all of those videos and guided breathing or meditation and all of that, it's been used as well. So as I said, we have a team of developers, so they like anything that it's online. All the technology features they absolutely love. So guys, I think we're gonna leave it here, because it's always good to finish 10 minutes early for everybody's mental health. And yeah, again, I really enjoyed the conversation when at Secret Source, when we read the research, and we had been working with Alan for a year, we just saw so much affinity that we felt that we really wanted to share the experiences with the wider world, and hopefully help some other people out there. And any other questions, as I said, we are all on LinkedIn. You can approach us there. So good afternoon, everyone, and thank you.
Thank you very much.
Thank you.
It was very nice being here.
Bye. Bye, Irene. Bye, Richard. Bye.
Bye.
Bye, bye, bye.